Hello and welcome. This is Deepak Mishra and I welcome you all to to my YouTube channel, Debinets International. And in this video, we are going to not talk about approbation or Berufserlaubnis or visa or hospitation or a consulting process or the language academy. We are not going to do any of that. What we are going to do is very refreshing, very different, will be interesting for you guys as well, I hope. We are going to talk about Notarzt. What is a Notarzt? Notarzt is literally it is a emergency doctor. Notarzt, emergency doctor. But the concept of Notarzt in Germany, the emergency doctor in Germany, is different than what I used to know in India or what I have seen during my rotations in the US. Here the system in India, what I have seen in India and in the US is that patients are brought to the hospital to be treated, even in emergency conditions. In India, family, relatives, friends bring the patient. In the US, the paramedic team, the ambulances, they bring the patient. Here in Germany, what happens is the doctor brings the patient to the hospital. The doctor goes on the street, on the accident place, or in the house of the patient, wherever they are in trouble, where medical emergency, and the doctor does the primary treatment over there. The whatever emergency treatment is required is done over there by the doctor and his team, and with the technical knowledge that he has, that is the medical experience and expertise that he has, and also the limited instruments that they can carry over there. So they go with that and they do it, and then bring the patient back to the hospital. At the end of this video, there will be a small video attached to it where you can see how the actual like training scenario that was a Notarzt course that I had visited a few months back, and we did some training over there, so that you can see the people have make those video clippings and have attached that clipping to this video. You can see how the Feuerwehr, that is the fire brigade team, comes and rescues the patient, like to evacuate the patient from that danger position. Suppose, for example, in the industrial building, fire or something, it's an unsafe place. The doctor can say that, okay, no, that is very unsafe for me and my team, I do not want to go over there. So it is a responsibility of the fire brigade to bring these patients out of this risk zone and give it to the doctor that, okay, now you can treat the patient. And it is also very sinful, because like makes sense, because doctors are not trained to be rescuers. They are not trained to walk in fires, and they're trained in medical things. So, and if you are always concerned about your worry about some beam on fire can collapse on my head or my team's head, you cannot provide that medical care to the patient. So that is and it is not part of the job description to getting into that kind of danger. The first rule of Notarzt training is keep yourself safe and your team safe, because you are the boss. You are the boss of all the medical things that is going to be decided over there, to be done over there. That you take that responsibility, and you are the leader of that team. Not only on the medical perspective, but also the strategic point, that which hospital the patient has to be taken, what kind of services, what kind of like procedures or specialties does the patient require. Does this patient require only, say, is a trauma patient, was in a, say, motor vehicle accident and has incurred, has got several bone injuries, or you have that thought that, okay, maybe he has abdominal bleed, or do you also need say a cardiologist, because you suspect that the patient has had a heart attack and that is why he he got into accident. So it is your analysis, your review of the entire scenario, that you decide, okay, where do I take this patient? First of all, I stabilize this patient. How do I stabilize this patient? What are his complaints? What are his problems? And then next, where do I take this patient? If I am in some mountainous area where I do not have a hospital, like say in 10 kilometers, then what do I do? I mean, small hospitals are there everywhere, but the specialty hospitals, I do not have that. What do I do? Do I call the helicopter for that? If the helicopter is going to come, it is night time, is the evening, can the helicopter fly? How much time it will take the helicopter to reach here, and how much time it will take for me to bring this patient in my vehicle, in the ambulance, to the smaller center. So you have to calculate many things over there, and that is why there is also a training. I'll give you a small description of how the training is. This Notarzt training. First of all, what is the eligibility criteria? The eligibility criteria is not very complex. It is like you must have 1.5 years of work experience. First of all, this Notarzt, emergency medicine in India or in US, this emergency medicine is considered as a specialty. Like you do a Facharzt training, that is a MD or MD emergency medicine. Here in Germany, it's not like that. Emergency medicine, that is Notarzt Weiterbildung, that is a Zusatzbescheinigung. Zusatzbescheinigung means additional qualification and not a degree. Like anybody can do that, anybody, as in example like a neurologist or anesthetist or a surgeon or an internal medicine guy, anybody can do this Notarzt extra course and work as under requirements that I'll tell you now. Requirements is that you must have done 1.5 years of your training of work in a clinical setting, in a hospital, in a, like, not in just an OPD but in a hospital setting. You must have done 1.5 years minimum work. Plus, you have done 6 months of ICU training, that is intensive medicine, it is called in Germany. So you have done 6 months in ICU as part of your rotation, and then with this done, now you have 2 years of work experience. 2 years of work experience plus you need to have a course, that is a Notarzt course it is called. It is mostly 80 hours course. It is the course I did, it was divided over 8 days. It is intensive course, very super intensive, from morning 8 o'clock till evening. You have some breaks in between, but it is very highly intensive. And there all the aspects are covered. Like for a surgeon, they also teach you how to treat a heart attack, or they teach you for as a gastroenterologist, they will teach them how to manage a polytrauma case. So these multifaceted, multidisciplinary approach has to be understood and learned in these courses. And then there are also practical things they teach you. I'll give you an entire list of what they teach, what is included in those courses. That is compulsory course that one has to do this course. At the end, you are tested on different skills and different analysis is done, and then you are given like that certificate of completion that you have done this, you have completed this course. And with that course, with that certificate, now you have to do 50 observation as in you have to go with the Notarzt, of the person who is working as a Notarzt, your senior. You have to go with them in 50 cases, and you assist him, you have to work with him, you have to see how he is managing, you have to document everything, and you have to learn in those 50 cases in real life scenario. You are going with a real life Notarzt in the real life emergency condition situations, and there you learn how it has to be done. And after you have done these 50 cases, then you have to take an exam by the medical council for this Notarztbescheinigung. And when you pass that exam is not very simple. That's quite difficult exam. But once you pass this exam, now you are authorized to work as a Notarzt. Why would somebody work as a Notarzt? First of all, it's very interesting. The variety of cases that you see, the difference, you go in with people who are adventure loving. For them, it's very interesting, because you go in unknown situations. You don't know how the family will react over there. Suppose if you have a person who is drowned in icy water, now he's going to go in hypothermia and is going to die. Now you have that thing that, okay, you have to save that patient, bring it to the hospital, but in the ice, suppose it's in the sea, now you have to like bring the patient to a hospital which can be, say, 10-20 kilometers away. How are you going to manage that? That is this logistics things that's very interesting for people. Suppose you are in a multiple accident place on a highway, say suppose Autobahn it is called. So on Autobahn, vehicles run very fast, like say around 200 kilometers per hour to 50 kilometers per hour. 130 is the average speed. So in this high speed, when the accident happens, the accidents are very severe. And then you are there as a medical doctor, you have to and arrange that, okay, you have a case, you have a patient, you have like accident vehicle. Now other vehicles which are going around you are going at that speed of 130 to 200 kilometers per hour. Now you have to work everything, you have to do everything keeping yourself safe and your team safe. If you are going to enter a building which has caught fire, it's an industrial building or something, now you don't know how many people are there. you are going to, I mean, obviously the Rettungsdienst, the fire, where the fire brigade has to bring those people outside, but you don't know surrounding area. It can be electrical short circuit, and the surrounding area can also be affected. If you are in a train accident, if you have to manage a train accident, then you don't know if the compartment is safe to enter to save those people. Or is it better to like stay outside, because it might happen that overhead wiring is fallen on the compartment and you do not know it from outside. As soon as you touch the train, everything is metal, so as soon as you touch it, you get that electric shock, or your team might get that. So these things are very dangerous. If you go in say there is a gunshot injury case, and in gunshot case you have been called and you do not know if the shooter, the person who has the gun, is still over there or has he fled the place. You do not know that, because it might happen that you enter the room and there is a person waiting for you and gun in his hand. So these cases happens. That is why it is said that safety is the first thing. Notarzt has to ensure safety of his safety and safety of his team, and after that comes the safety of the patient, and you have to bring the patient living to the hospital. That is your job, to bring the patient living to the hospital. So and rest the team and inform the team beforehand, so that they can manage and they can be prepared. Whenever, like when I work in trauma here in the hospital, and the shock room team, they call you, they tell you about they don't call you, they call the hospital, the reception, like there's always a note file number. They call them that number, and they describe the accident, what kind of accident it has been, and some information, whatever information they have, they give, because they also don't have all the information right away. They as time passes, as they analyze more and more, they get more and more information. So they give the primary information, what injuries are expected, what will be required by the hospital. They give that. The team at the hospital, they mobilize the entire team. The shock room is like everybody's informed. The trauma surgeon comes, the anesthetist comes, the radiologist is on standby. The assistants over there who do that scan and everything, they are there. The nurses are there. Now, like you have informed them, they are ready. You tell them how much time it will take. It will take 5 minutes, 10 minutes, 15 minutes, whatever. If you need a helicopter to be arranged, that okay, you will bring the patient for primary treatment over there, control bleeding, stabilize the patient. But the hospital is a small hospital. You know that this hospital cannot manage this kind of trauma or this kind of. So then you tell the hospital right away that okay, this is the case. I'm coming to you with this patient, but we are going to do this, and I am already informing the helicopter, like the doctor on helicopter, so that they will come on timely, and by the time we manage this patient, we will arrange transfer to another bigger center, to the university center. So these things have, this organization is also your part. And Notarzt is not only a medical person, he is a decision maker in entire logistical thing. So see the cases, the examples that are there. First of all, you learn a lot about ABCDE, that is the primary survey and the secondary survey. You learn a lot what are the problems, to diagnose the things. You learn about how to like immobilize the patient. That is a very significant thing in India. It's very sad that when I was working there as an intern, and after that as in surgery departments, we used to see people they were brought on auto rickshaw like after accident, they were brought in auto rickshaw, cycle, motorcycle, and because there is no other option, and it is still happening over there. I'm very sure, like I have not followed up in last few years, but I'm thinking nothing much has changed over there because of the lack of resources and the lack of, I don't think that people don't know it, doctors or the trauma people don't know it. They also read the international books that we read here, but because of the lack of resources, it cannot be done. It has not been able to, it has not been done so far. Here, immobilization after an accident is the most important thing. You have to always treat a person after accident, any trauma case, neck, the CV, the HVS, it's Halswirbelsäule, it is called the cervical spine injury, has to be assumed until proven otherwise. You have to assume that okay, the vertebral column has gotten some injury, and you have to immobilize the patient and then bring the patient to the hospital. Yes. Then you will learn about narcose, that is anesthesia, that is notfall narcose, emergency intubation, emergency anesthesia. Even internist has to do that. Even a cardiologist has to do intubation and do narcose. Even a surgeon has to do that. So these things everybody has to learn, these multidisciplinary things. You have to learn about learning. As a surgeon, I cannot say that, okay, I'm a surgeon, I do not know ECG, I do not read ECG that often. I must know that, not as good as a cardiologist, not that which type it is and how many, what is the axis difference or axis variation. That I don't need to, because that is work of the cardiologist. I do not know that. I'm not experienced in that. But what I need to know is those 4 or 5 emergency conditions. If it is ventricular fibrillation, if it is VTAC, if the patient has already died, if it's asystole, because that will influence my further treatment. How is the patient? If it's asystole, what should I do? How should I attach the defibrillator? How should I do the resuscitation? That reanimation it is called in German. So how should I do the resuscitation? How should what voltages? How many joules should I start this reanimation thing? Who will do how many? The entire cycle of reanimation has to be done. What medications do I have to give? What is the dosage of those medications? So these things, even coming from different backgrounds, these life-saving methods and things that has to be known, like that has to be practiced. And the cardiopulmonal reanimation it is called. That's the basic life support and advanced cardiac life support that has to be done. You learn that during this process. You learn about all the emergencies, cardiac emergencies, lung, like pulmonary edema, those stroke patients you deal with obviously fractures and trauma patients. So you need to know that thing. Yes, there is always in bigger cities drug addicts, the people who use those needles. You deal with those people. You go there, they can get aggressive sometimes, and you do not know if they have a needle in hand. They can injure you with that needle. That needle might be maybe hepatitis or HIV infected. You do not know that. So you have to, again, the safety of your team and your safety becomes very important over there. Also, other things in trauma, you have this pneumothorax, hematothorax, that you have to clinically, you do not have an X-ray over there in your Rettungswagen, in your Notarzt vehicle. So you don't have X-ray. You have to clinically find out what is the symptom. You have to hear it. You have to do the blood pressure. You can do pulse and saturation, how much it is. You can so these things you can do, and you can find out, okay, this looks like a hematothorax or a pneumothorax. You have to do the evacuation of pneumothorax, that air with the Monaldi needle on the spot. Maybe it might happen that you have to put a chest drainage at the spot. So you should be able to put that chest drainage on that seat. It might be on the road. It might be that temperature. Here in Germany, temperature is a major issue, because 7 out of 12 months, the temperature is around 10 degrees, and in 4-5 months it is in minus. So it might happen that you are on the street, some elderly person has on the street after having lunch has developed chest pain, and was climbing the stairs and has developed chest pain, has collapsed. You reach there, the temperature outside is say minus 15 degrees. Now you are sitting over there in minus 15 degrees temperature with a patient you have, and you have to work. Might happen that it's starting to rain. So that is the entire that is the challenge in this. That is very, as I told you, people who are adventurous, who like taking risks and doing these things out of the daily routine of the hospital. This becomes very interesting and very challenging. Plus the financial benefits. It's a quite lucrative job because of the risks that is involved and the training that is necessary for this. It is quite lucrative. That if you do say 124 hours duty as a Notarzt, you earn around 400-500 euros in hand, like netto, after all your taxation and everything. So for 24 hours, if you're earning 400-500 euros, I find that is a pretty good compensation for the work that you have been doing. So neurologic incidences like the stroke and epilepsy that I've already told you, there can be the training is the trauma training is based on ATLS. There is some difference between ATLS and Notarzt training, but I, being a trauma surgeon, refer to ATLS even during Notarzt working with Notarzt and everything. I have not got my shine so far, that the authority, because I have not completed those 50 what you say, that going with the Notarzt because I'm not finding time for that. For that you need time. You have to wait with the Notarzt in his like the office or his room, whatever, and because you do not know when the pager will go off. You keep waiting and suddenly the pager goes off. And then you rush. You're already clothed in that Notarzt dress and everything. That you just wear your shoes and you just run in the vehicle. The driver runs from his side, and everybody goes there together. Might happen that you are on the way to one trauma. You just completed one case, and then you are just getting in your vehicle, and again your paper goes off that okay, now there is this case at this place. You put that, the driver gives that address in his navigator, like in the navigation system, and then you get the address, how much far it is. You reach over there and you deal with the new trauma. You remember, you have to know the dosage or everything. So we always, it's very stressful situations, and to remember everything in that stressful situation, it's very difficult. That is why many people, like it is recommended. It is not a matter of to show anybody less, but it is recommended that every Notarzt, every doctor carries those pocket booklets where all the dosage of everything is given. All the emergency things that are required is given over there, so that in case of emergencies, in stressful situations, you do not have to refer to your memory or try to memorize things or try to recollect things. You can just open that book and see what is the value, how much should the dose be. That makes so that the life of the patient does not depend on your recollection during such stressful situations. That I find pretty good. That is actually encouraged, that everybody should do that. They give you books that okay, you have big pockets as Notarzt clothes. When you see those clothes in that video which I'm going to attach to this later on, you will see that they have big pockets. You can put those books, your stethoscopes, those things in those pockets. There are cases of electrical situations. Then how do you manage in those situations? Also about in English I forgot the word, but there are many people injured, massive trauma. There are many vehicles in accident altogether. There are say 20 people injured or say 50 people injured. So you alone as a doctor, you cannot do everything. What you do, you are first on spot, you triage whom you can handle. You triage, then triage system, we know everybody knows green, yellow, red, black. So these triage you can do, and you can inform the light teller, the call center, which is responsible for all the arrangements. You call them that I have this situation, I need this many Notarzt, or I need this team. I'm taking these patients this place, these patients are like this. You can give the entire review, entire debriefing, and then they will arrange and they will send you reinforcements. They will send you more Notarzt, more availability. Depends upon availability. Might happen that they say that no, we have a multiple injuries at this site, so we have limited resources, you are on your own. Might also happen, and then it is upon your intelligence and your creativity that how you manage that situation and how you save maximum number of people that you can save. You cannot save everybody. Obviously, if you have 10 heavily injured patients, you cannot save all 10. But are you going to save one, or are you going to save 3? What work can the assistant that you have, the Rettungsdienst, you have mostly a team of 4 people, one, you are the chief, you have one driver, and there is this ambulance. So the people, Rettungsdienst, Rettungssanitäter, they are also quite well trained, but they are nurses. They are basically nursing training they have. They are not doctors. So you have a team of 3 people and you are the chief, team of total 4 people. So how are you going to utilize that team of 4 people? Who will do what and what you will do? So these management things have to be done by you. And also treatment of children, that is very significant, because if a child has suffered something, some injury, or has suddenly become unconscious, something, then the parents are there and they're very anxious, and there you have to be very careful how you treat the child, how you treat the patients, the parents, how you talk to them, how you can counsel them. These things are very, very important. And there are many other issues that are covered in Notarzt topic, but it is outside the purview of a small video like this one to cover everything and to give you details. I have tried to give you perspective of how Notarzt is, what Notarzt is, and I think if the guys who are watching these videos in future, definitely you will have approbation, you will be working here in Germany, and later on you can know this, that okay, this is Notarzt, and if you're interested in these kind of things, you can do this as a, this is not a full-time career. I mean, you work in the hospital and you do some duties as Notarzt. So yeah, that some hospitals are like doctors who do Notarzt, some do not like, because when you are working as Notarzt, you are not there in the hospital. So but I mean, this is a good like secondary qualification. As a extra qualification, it's very good, it's preferred also in your next job interviews and everything. Whenever you are working as Notarzt, or you have done that Notarzt course, that means that you are good enough to, at least, even though you are not, when you are not working as a Notarzt on the streets, you are at least qualified enough to manage emergency situations which arise in the hospital. If there is some patient in the hospital who has pneumothorax, or who has say hemorrhagic shock, so you are Notarzt, you have treated these patients on the streets. Now you are, with your expertise and qualification, you are in a hospital setting, so that is much more favorable setting to you. So these things are considered very regarded very highly here in Germany, and I would recommend that people, guys, after some experience and something, like after some time, you guys should do this course. It gives you an additional edge, it gives you confidence. Secondly, not only the medical, it gives you confidence that okay, I can manage this, and because you have learned that additionally. Alright, then with this I conclude this video here. As I've said, continued will be the Notarzt training, a small clip. I hope you guys will like that, and take care. Bye bye, see you next time.
Gaffer.
Von hinten kommt gleich ein Kollege zu Ihnen. Was ist passiert? Tut Ihnen nur das Bein weh, oder haben Sie noch mehr? Tut Ihnen nur das Bein weh, oder haben Sie noch mehr? Der Bauch. Sonst alles gut bei Ihnen. Übernimmt? Ja?
Darf man da näher ran?